Hi, alright folks, welcome back. Okay, we're going to have a wee conversation about COVID and the vaccination rollout yet again. And here we've got, you heard it first on Glesga News, my objections to the extension between the two doses. Say it's Pfizer, for instance. You get your first jab and then you're supposed to get your second jab within 3 weeks. That's what the study that Pfizer conducted told them. They get 90% immunity if you follow that procedure. The government set up a committee, and this committee of non-Pfizer scientists, they came up with a 12-week gap. And I've been telling you all along that that is going to cause nothing but grief. Okay, and now the doctors are starting to speak out about it. And this particular GP, and by the way, that's not even saying whether they're mixing the different types of vaccine. Let's just stick to Pfizer and the time frame between the first and second jab, all right? We'll not complicate things like they are by giving people two different vaccines 12 weeks apart. But anyway, I'm ranting. Here we go. So a GP says delaying the Pfizer COVID vaccine second dose for 12 weeks is an unlicensed trial. And that's exactly what it is. They're trying it out on the population. Let's just give them it in 12 weeks. You can bet your books everybody on that committee, though, have had their second jag within 3 weeks. Have the politicians had their jag? Have they waited 12 weeks between a jag? No. But your kids, your parents, your partner will have to wait 12 weeks. Dr. Rosie Shire, a member of the Doctors Association UK, said it is not known how effective the Pfizer vaccine is going to be if the gap between the two jabs is longer than 3 weeks. Now that's right, Rosie. I've been saying that for months. Doll. A senior GP, there she's there. All right, Rosie, you made it right onto Glesga News, hen. A senior GP has hit out at the extended time gap between doses of coronavirus vaccinations, branding the move an unregulated and unlicensed trial. That's right. The government is under pressure to shorten the current 12-week period between the first and second jabs. Dr. Rosie Shire from the Shire, sounds like something for Lord of the Rings. She's from the Shire. What height she is. Anyway, I love her. A member of the Doctors Association UK said, I already said that, Rosie, but she said it is not known if it is as effective if the gap is longer. Christ, spit it out, will you? The government and health bosses have previously opted to administer a first dose to as many people as possible, and that is an absolute scandal. A scandal of the first order. They're not doing that to themselves, of course. They will be jabbing themselves 3 weeks apart. Right? We need to ask the question. The BBC, STV, Channel 4, the Daily Record, the Sun, the Mirror, every bloody paper in the world needs to ask these people in that committee, get a hold of them and say, have you had your jag? Have you had your second jag? Because they don't try that shit out on themselves. They try that shit out on you. Sitting there in your canteen, sitting there in your house, in your hospital bed, right? The nurses are getting their jab 12 weeks apart. Nurses, doctors, right? You had the police there, the mob saying, oh, can we get the jab a wee bit earlier than everybody else? No, you can't. But we're key workers. Well, so am I. Some of my pals have to go into people's houses, right? Not just standing outside firing fines through the window. Bloody mob. There she's there. All right, Rosie, I love you. Anyway, what really concerns us, we don't know what happens if you don't give the second dose of the vaccination after 3 weeks. She told Sky News, the fact is that people are being vaccinated now and being put into what is effectively an unregulated, unlicensed trial, whereby they're receiving this vaccination on the understanding that they don't know what's going on. That's right. She said 3/4 of all people over 80 in the UK have been given the first dose of the vaccine, but added this does not mean they are fully vaccinated. Exactly. I've been saying this for months. You're only fully vaccinated when you receive your second dose 3 weeks later. No, 12 weeks. We're no interested in some maniac Scottish or English health minister saying, well, you know, we're quite impressed by the antibodies that are being produced. Listen, you don't work for Pfizer and you don't work for AstraZeneca, right? You don't know what you're talking about, mental case. The vaccinations should be given out as per the scientists' recommendations from the companies that developed the vaccination, right? The people that developed the vaccine spent a lot of money, a lot of time, and they done a trial. They didn't wait 12 weeks, they waited 3 weeks. But you think you know better, don't you? Can you imagine if it was you maybe doing this in your own sort of work environment? Never mind what the document says. This is what I say. Never mind health and safety. I'm no doing that. This is what I'm doing, all right? And we're going to try it out. They would fucking jail you, right? And I'll tell you another thing that's happening, right? A lot of employers are deciding that they're going to take a note of who's had a jag and who's no had a jag. And they're going to then hire and fire, create rules based on that. Well, here's news for you. See, your medical records, they're confidential, right? So I say to all the big blue chip organisations, do not fuck with people's medical records. It's none of your business whether we have a jag or we don't have a jag. And I don't mean a motor, I mean a vaccination or not have a vaccination. How many weeks or what type? I can see a lot of court cases. I can see a lot of unions objecting to a lot of shit, right? And people will get really angry with any companies that try that sort of shit, right? I'm telling you right now. I'm sorry, I kicked right off. A private letter seen by the BBC said, the current plans of people waiting up to 12 weeks for a second dose, which Secretary Matt Hancock said is supported by data from an Israeli study, oh that's brilliant, are difficult to justify. It said, the absence of any international support for the UK's approach is a cause of deep concern and risks undermining public and professional trust in the vaccination programme. However, Public Health England Medical Director Yvonne Doyle defended the decision, which she said had been taken on public health and scientific advice. But they don't have the scientific advice, they're just guessing. They're lying to you, right? They're liars. They're crossing their fingers when they're talking in microphones. The more people that are protected against the virus, the less opportunity it has to get the upper hand. Protecting more people is the right thing to do, she told the BBC4 programme, Today programme. People will get their second dose when we feel like giving them it. It is a reasonable scientific balance on the basis of both supply and also protecting the most people. So it's about supply and demand, right? It's a rush job. It's a hatchet job. That's all it is, folks, right? It's an absolute fucking scandal. And you should remember it, right? When the virus rushes out of control, when the virus is no longer curtailed by the vaccination because the virus is mutated, because it's given too big a gap in between, the virus could adapt to that and become vaccine resistant. When that happens, folks, it will be absolute mayhem in this country. And those people, remember them. In Scotland, remember Nicola Sturgeon. Remember the SNP. Remember that woman telling you that it's okay. Remember that guy telling you it's okay. And remember her that I've just quoted, Yvonne, whatever her name is, Health England. Remember they people when your children die, when your relatives die, when you get a dose of this COVID-19 that is resistant to the vaccine caused by these people. Remember them. Anyway, if you like the content, hit the like button, share and subscribe, because that is all I've got to say about this. Peace out.